we're going to talk about multiple endocrine neoplasia, in particular MEN3 in this video. MEN3 is also known as MEN2B. And multiple endocrine neoplasia 3 consists of the following things. So there's three things. The first one is a thyroid tumor known as medullary carcinoma. Medullary carcinoma of the thyroid. And the second aspect is a tumor of the adrenal medulla. That's the gland, and the name of the tumor is pheochromocytoma. And the third aspect of this disorder is something called mucosal neuromas, and those are the three parts of MEN3. So what kind of presentation would you get? Well, first I'll show you a picture of this to kind of give you an idea of what it is. These are neuromas, as you can clearly see. These are small bumps on the lips or tongue or mucosa. They can occur also on the eyelids, and they can also occur in the intestine as well. And if they occur in the intestine, they can cause GI problems. But that's what the neuromas are referring to. The next one I'll talk about is this one. This is a tumor of the adrenal medulla, and it secretes two very significant catecholamines, epinephrine and norepinephrine. Norepi. And this tumor, because it secretes very high quantities of these two catecholamines, the symptomatology is related to those two catecholamines. The first thing that these two do is a very powerful vasoconstriction on the blood vessels. And when you vasoconstrict a blood vessel, that increases the blood pressure. So hypertension is a very big component of pheochromocytoma. But what's interesting is that when this tumor happens, it releases these catecholamines in sort of a episodic way. So, it's normal 1 minute, and then, a few hours later, it's very high. So you get these paroxysms of symptoms, and the symptoms have entirely to do with the actions of these two catecholamines on the body, which are sympathetic nervous system response. So not just high blood pressure, but anxiety, sweating, rapid heart rate, increased heart rate, things like that. Medullary carcinoma of the thyroid is a thyroid tumor, and it would present with a lump in the neck, and then there's other tests that will be abnormal, and I'll get into that a little bit later. So someone presents with these types of physical exam findings or that type of a history. Well, how would you diagnose it? Well, let's start with the thyroid tumor, medullary thyroid carcinoma, and then we'll talk about pheochromocytoma. And then the mucosal neuromas are just something that you would see on physical exam. If it's in the intestine, then most likely you'd have to do a colonoscopy, but there's no lab tests per se. Well, both of these, first of all, because they're tumors, you'd probably have to do some type of imaging to localize them. So that's the first part of the diagnostic workup. But there's some lab tests that are very interesting. The thyroid one has a very interesting one that isn't very often done because it's so specific. But here's the name. It's a pentagastrin stimulated calcitonin test, and that one will point to a diagnosis of medullary thyroid carcinoma. The pheochromocytoma, how you detect that is that those catecholamines that the tumor secretes, epinephrine and norepinephrine, break down into metabolites, and those metabolites are known as metanephrines. And those metanephrines can be detected as either a blood test or a urine test, either plasma or urine test. So that's part of the diagnostic workup of MEN3. And then finally, treatment. It's really primarily a surgical treatment. And then, of course, as always, all the MENs are, all the multiple endocrine neoplasias are genetic or hereditary. They're actually autosomal dominant. So part of the management is genetic testing in the families. And then finally, I have a couple of vignettes I'd like to go through, and here they are. A 29-year-old man presents to a physician because of multiple small nodules on his lips. The clinician notes that the patient has a marfanoid habitus, which is also a part of MEN3. Can be a part of MEN3. Biopsy of one of these nodules demonstrates a mucosal neuroma. Which of the following screening tests is indicated? Well, if you had seen some of the other MEN videos that I had made previously, you could tell that this one is part of gastronoma that occurs, and this is parathyroid adenoma or hyperplasia. To check for it, this is the VIP-oma that can happen, and this one, well, this is a very straightforward way to check insulinoma. All of these are part of either MEN1 or MEN2, and by default that actually leaves MEN3, which is choice A. But what really gives it away in this particular vignette is the mucosal neuromas, which is really only part of MEN3. So, and finally, a 40-year-old male has paroxysmal hypertension. He is subsequently found to have medullary carcinoma of the thyroid, pheochromocytoma, and mucosal neuromas. Parathyroid involvement is not noted. What is the most likely diagnosis? Well, you can't get any more straightforward than that. They basically told you the three things. 1, 2, 3 things that are part of MEN3. And just so you don't get confused, MEN3 sometimes is also known as MEN2